You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back, Health Innovators. On today's episode, I have someone I'm really excited to speak to, Nicola Brown. She is the founder of Kokoro. Welcome to the show, Nicola.
Thank you for having me, Dr. Roxy. I'm so excited for our dialogue today.
Me too. So I always like to start off with having you tell our audience a little bit about your background and what you're doing these days, just to kind of give some context for our conversation today.
Absolutely. So hi, everyone. Hi, every health innovator out there. I'm Nicola, and my background is pretty varied. But on the back end, when you look at it, you can see that everything has stacked up to lead me to where I am. And so I started out as a community researcher, looking at community health from an environmental and ecology lens, and then landed as a clinician doing trauma prevention work. And like many health innovators, we have had our own health experiences and journeys. And so myself, I became unwell. And in that unwell period of time, learned that the way the system works doesn't really work for someone that's unwell. And so I nursed myself back to health using Eastern, Western, and non-traditional ways of being. And that's what led me to Kokoro. And that's what we're building right now, is using social connection and data to support you being well on your terms.
That's awesome. So it's really interesting because I think a lot of times our careers do take a really checkered path more so than we realize. And then just like you said, you kind of can look back and go, wow, everything was really leading up to today. It all kind of makes sense, although maybe we didn't know exactly where we were headed at some point in our career.
Absolutely. I think like if I were to say something to my younger self would be, hey, everything is going to matter. So enjoy the present moment, be right where you are, stop trying to know 10 years down the line. This present moment is going to matter and be significant.
Right. Yeah. So true. If only we could go back in time, but even if we could, our younger self probably wouldn't listen, right?
You're right. That's like healthcare. When you think about it, your doctor tells you if you do these things, you'll be healthy. And you're like, yeah, but I'm not, because right. I have these things to accomplish. So I'm just going to continue with the level of stress and not decrease it.
Right. Yes. Which kind of leads us to your company, right? On this show, we talk a lot about commercialization and how to, share strategies and kind of war stories and helping, as a community to kind of move the needle a little bit on that success rate. So when did you start the business? You kind of told us a little bit about why you started it, but what has that journey been like so far?
All right. So we took a unique approach to the business. We started in 2018 and we did research for about 8 months where we were deep diving, having conversations, and really doing prospect research of, yes, this is my experience, but how many individuals are seeing this as their health journey experience to validate the market. And also to identify who our customer was going to be at that stage of the company. Fast forward 2019, we launched a bespoke package where we brought healthcare to you. We came to your office and we sat in your office as the CEO or the C-suite leader. And we actually watched and saw the patterns of what deters you from doing things that would benefit your health. And that those things were what would seem small, like your water intake, the number of interruptions that you have when you're trying to do one task that deters your mind. So we looked at that. And with that, we then developed our first signature experience. But along that way, we had pits and falls and light drops. One of those things we did, and I shared this with Roxy, was that we thought our customers wanted to be on a platform immediately, because platform is king in the startup ecosystem. And that's what we talk about. Build your platform. What type of platform are you building? And what we learned was that our customers needed to build trust first and wanted a smaller way to engage with us. And subsequently, that became SMS messaging. And we started out doing that with our own mobile phone. So for you innovators out there saying, I can't pay for a text message service right now, we did it from a phone that we were already paying for. Mm-hmm. And once that list grew, then we paid for a service once we had paying customers to transition to that. But the learning curve has been iterating based on the customer insights versus iterating based on our experiences as the founder and the core team. And as I say core team, I've been fortunate to have other practitioners come alongside me for this lofty vision that we have about healthcare being integrated into the flow of your life. So we have brought on board Brian Outlaw as our CTO, who understands healthcare tech infrastructure in a way to catapult us forward, and also understands his own health integration experience to be able to talk about that. And then we brought on board Dr. Agrindi and Dr. Braun, and both of them specialize in the mind-body interaction. So a lot of times we think about healthcare and we're only thinking about the disease or what is causing us dis-ease, not necessarily like the integration of our organs and how that supports us in being. And so that is part of our evolvement as a company, is that we have really listened to our customers in a way that from the outside looking in, you may not say success is there today, but what you see is that our customers are our biggest champions. And that's how we've grown so far.
Mm-hmm, mm-hmm. So I want to dig deeper into the customer discovery conversation. So we've talked about customer discovery on other episodes, but one of the things that I think that you bring that's so unique is I wasn't leading you to this part of the conversation. You said this on your own. We started with research. So obviously, coming from a background as a researcher, you're defaulting to what you know, but it's just absolutely brilliant. And I just don't see a whole lot of innovators start. I mean, honestly, a lot of the innovators that I talk to, they start with a logo. They start with a website. Like, let me come up with this cool brand name for the company, and or maybe some cool tech. Let me start with the product, and really, you're not starting with the customer. So let's just talk about that a little bit more and what that experience was like for you. And then I also think kind of dovetailing into some of those things like you just said, where you had this assumption or maybe a set of assumptions, and that real research debunked that, and what that felt like inside. And how that, and that wrestling that may or may not have been that happened as you made the business decisions for yourself and the company.
Oh no, the wrestling happened. Like, I won't deny the wrestling happened. Okay, so our research process started this way. There is research that's done in academic institutions that is considered health longitudinal research, that is participatory, that usually has a control as well as a control trial component to it. Mm-hmm. And so our first stab was, let's pull all the different research studies that talk about the need for health to be integrated and not be something that you do when you're unwell. Mm-hmm. So how do we get to the I am well, how do I know what I'm doing? What is my recipe so that I can continue being well? And if, for instance, I become unwell, what do I do? So that was our first step. The second step was, who are the least likely individuals to want to do anything now about their health? And
the path of most resistance.
The path of most resistant. Because if the most resistant person can understand our value proposition, we know that there's a there.
Yep.
And we're not doing it off of one most resistant person. We're doing it after multiple. So we had a net goal of having a min of 13 people in the first cycle of testing this.
Mm-hmm.
And so we thought about, what is the characteristic of someone that's going to be resistant, right? It's going to be someone that they're the leader. So I can't show that I need this support because everyone is looking at me to support them, because leaders eat last. Mm-hmm. And we are taught to be servant leaders. So we got our person, a leader. Mm-hmm. All right. What do we already know? We know that entrepreneurs are more prone to have mental health issues and physical health issues than any other sector. Mm. So 2, we're going after entrepreneurs. Mm-hmm. And so we had our 2 and we started scheduling conversations. And this is cold LinkedIn reach outs, guys. This is not tapping our personal network to people that are going to tell us, yes, it's amazing because they love and care about us. This is stranger conversations. And so that's how we started those conversations and started looking for patterns. As a researcher, my role was sense making. So making sense of the patterns. So mm-hmm. my default is to look for, what are the patterns here that are unspoken, mm-hmm. not the things that we can readily see. Oh, healthcare is broken. Yes, but how? Like, what part is broken? Mm-hmm. In that navigation. And so that's where we started with our research. And then we grew from insights from there. We did a lot of conversations and focus groups with individuals as well as a secondary level, understanding what it meant as a business leader to feel well and unwell. Mm-hmm. And the salient team question and conversation that it came back to was, when I'm well, everything flows and everything is integrated in my life. It doesn't feel like another thing. It just goes. Mm-hmm. And mm-hmm. presently, our system doesn't go.
Right. So there's a couple of things that so there's a couple of things that you described. So there's all these biases that I talk about: confirmation bias, selection bias, and you seem to have been really intentional. Is that, like you said, I'm not just looking for people to validate or confirm what I already believe to be true, and you weren't even selecting people to participate in this research that were going to maybe skew the data to wherever you wanted it to go, that you were really seeking out new insights and testing hypotheses as opposed to preconceived notions that you were just looking for validation for.
Absolutely. And one of the things, our core insight that we took away was that the thing that leads people towards where they are and how they view their health stemmed from the thing that people and business owners, everyone would have heard this. When you ask a business owner what's keeping them up at night, they will say money. Mm-hmm. And we forget the integration of money and emotions on our health and well-being, mm-hmm. and how that subsequently affects our choices with regards to health and how we then show up.
So deep, Nicola. No, so deep. I like it. Okay, so I want to keep digging into this customer discovery bit.
Okay, come on.
So I hear things like, well, I don't have time to do all of that research because there's a window of opportunity and I gotta have to get to market now. Otherwise, we're gonna lose our opportunity to make a successful business. What do you say for that?
How many million people are on the earth? Like, that's my response. Like, there's so many people on the earth. And if you think about anything that exists, there is not one person monopolizing an industry, and nor would we want that. So the idea that I need to hurry up and get there is crazy to me. Because like in the hurry, you are cutting corners. And so you're subsequently not even doing the vision that you really want to see executed in the world. You're like, okay, I'll cut this vision short. And at some point I'll double back. I understand that there's a window with regards to innovation. And so you patent things, you get things copyrighted, you get a great legal team like we have been fortunate to have at Kokoro. And you find experts in your field that are able to give you the foresight from a futurist lens of where things are heading. Because if you're building something for right now today, by the time you build it, it's almost obsolete. So let's think about, if you're being an innovator, let's think about it. Are you thinking 10 years or immediate future?
Yeah. And, sometimes I think it's ego that's involved too, where, it's ego or pride that makes us think that we need to be first to market because that's going to be the successful strategy, or that's going to make me feel or look really good. If nobody else has done this before, I'm the first. And, that's not always the best strategy either. And so maybe being second or third entering the market is not that big of a deal. It might actually be to your benefit that you actually waited 8 months or a year to conduct this research, because now you're entering the market in a much better way than actually you would have had you just kind of, like you said, cut the corners and just got in there.
Who was the first email provider?
Was it AOL? You've got mail? I don't know.
but see, that's the thing. No one knows. I can't tell you the answer to that. Right. I'm asking the question, but I don't know the answer to that.
All I hear is, you got mail.
Right.
And I think of, is it When Harry Met Sally or one of those Meg Ryan movies or something?
Exactly. But that's the thing. That's the grounding that I will say our team, via our legal team at Goodwin and our core team that's internal between Kokoro and our supporters and initial funder from Mvanti, what they keep telling us is like, you don't have to be first. Right. You just need to be great at what you're doing, because that product will speak for itself.
I hope everyone heard that. If not, rewind, play again.
We'll pause for you to rewind. Right.
So how many surveys or interviews have you conducted in the last 3 years since the time you started? That gives some color and perspective to this conversation.
We have done over 300 surveys.
Wow.
We have done over 200 assessments on different emotional states. Mm-hmm. We've spoken to roughly almost 500 practitioners around the world that talk about health, have done a webinar about health. We have not been shy about reaching out. Hey, we saw your talk about this. Want to have a conversation about how you're thinking about this now and in the future. So I will say to the listener that's like, man, that sounds like a lot. It is.
And she's like, it's a lot of work, people.
And we didn't do it overnight.
Yeah, right.
every step of the process, we are continuously researching and iterating. We are not married to one journey path. We are okay with the ebbs and flows of, we got this new insight, like I told you about the platform. That was a huge jump back, because that meant that we weren't going to raise capital right away, because investors are looking for the tech. They're not looking for the service per se. They want to see the tech behind the service. And so that meant that we needed our service portion to bring in enough to sustain what we were doing, so that we could continue to build the tech at the pace that works for our customers.
So let's dive into that a little bit, because I think that is something that would be very valuable to our listeners as well, is talking about, the conversation that you have with investors or advisors or, your key team members about, like run rate and cash flow and revenue, and kind of like, okay, paid sales, money coming in versus, we just need to keep interviewing more people. We need to have more conversations. And obviously, as your job as the founder is balancing those two things, which is probably science and art.
It's a creative process to figure out how you're going to bring money in to your business. One of the things that I was grateful that I didn't know was part of the startup culture was that people built things and didn't have people pay for them.
Right.
I did not come in with that insight. And so for everything that we did, we were like, this is the cost. Or like presently, we have offerings that are tiered intentionally towards your socioeconomic status. So it's not a barrier to entry, but it's also learning for us as a company, as we're thinking about our pricing models and our structures, et cetera. The other thing I would say around pricing is that you're going to get it wrong. And our key strategic advisor right now nudged us in the fall and was like, hey, your services are kind of cheap. You might want to adjust your pricing. And that nudge was, hey, when we started, we had no idea what the costing was for what we were offering. So we took a guesstimate at the price. Now we have data. So why aren't we using that data to modify our pricing? And as a result, we modified our pricing with that insight. But it takes having your own, as the CEO, your own personal board of advisors, because it doesn't matter if you're a serial entrepreneur. Each time you're building, there's new knowledge that you won't have. And so having experts around you to support you and guide you is critical to this process. And I am always seeking out people that have a skill set that I don't have, because I am not trying to be all things to all people.
Yeah. And that's so important, right? The example that you gave on the pricing. Also, had you been outside of the company looking in, you probably would have looked at it and go, wow, their pricing's really low. But when you're in it, it's so hard to see that. So, sometimes it's a different of expertise, but sometimes it's just a different level of clarity, just outside versus inside.
Absolutely. And sometimes you get so caught up inside of the internal workings of the business that you forget to go back to the 30,000 foot view. To see how far you are on the journey, because it is in fact a journey.
So did you compensate, or what were your considerations around compensation for customers to participate in your research? Did you pay them for their time? Because that's the other thing I hear is, well, I'm trying to sell to so-and-so, and I'm never going to get them to spend 20 minutes telling me, helping me build my company and my product for free. So what was that experience like? And did you compensate or maybe not? And what did you learn from that?
So we didn't compensate in the traditional sense of everyone that participates receives a gift card.
Yep.
What we did do is if we were meeting you for breakfast, we bought you breakfast. If we were meeting you for lunch, you got lunch. If we did a focus group, there was a full meal provided. Mm-hmm. So we made sure that we did things honestly around meals. That was a conscious decision because that's a meal that you don't have to think about. Yeah. And there's so many things around social connection and thinking about what conversations comes up as you are eating. And so that played into our holistic looking at an individual. So that's how we navigated that sphere. But I do know I have been fortunate to interview with other startups that are providing gift cards to different entities for the insight that you provide in a 30-minute, 60-minute conversation. Mm-hmm. And I think that works too. But what I would say is do not put yourself in debt to pay for the insight that you are getting.
Right. Yeah. Yep. Absolutely. So what has research and distance selling been like amidst the pandemic? How has that changed things?
I would say it hasn't changed us much. Okay. We have been a remote first team. So we have been on Zoom before Zoom was hot. And so we've gotten that under our belt. And with regards to our customers and having conversations, we still prefer dialing your number and having a conversation. That has not gone away as much as one may assume or presume. And we still do text messages, but on a first instance of telling us what's going on, we found that the narrative feedback is so critical to our iteration process and our growth process that we bank time in for that each week. So one of the things that I would say is like time for research and development that is structured and banked into the flow of our team's week has been critical versus, we haven't researched anything in a while. We should tunnel in and do some research this week. For us, it's been a part of our being. Yeah. And so we know we research every week. Everyone has a different time period that they're doing it, but you're taking time to intentionally research. Some of that is looking at our customer data for the last week. Others is looking at what are new insights that we need to know based on what we saw in our customer data. And so that is a core part of how we operate as a team and our company culture. And our research is focused on impact because success can look so squiggly for everyone. And for us, we want to know what is the longitudinal impact of what we're doing today.
Yeah.
And so, like, I'll give you an example. One of our business owners just bought their first house. And that is success. And you'd be like, what does buying a house have to do with their health? But they had been stressing about this opportunity for so long that it started to add to the stress of operating their business.
Yeah.
And we know stress is the silent killer.
Right. Yep. Absolutely. So yeah, I definitely think that it's important that you mentioned that really research is like a fundamental core value or part of your company culture and has been from day one. It's not something that you do in a moment of time, oh, well, every quarter we go out. It's just who you are and what you do. And I love that. And I think that, as someone on the outside looking in, I think that is going to be and continue to be a game changer for your success in the company.
Thank you. And I would say it's also how we empower our customers. We're providing them with opportunities to become researchers of themselves so that they can better understand their health and well-being.
Yeah.
And we believe well-being done well is when you are able to articulate what you are feeling, sensing, knowing to someone that may be the expert in that area to then come collaboratively to a decision of what is taking place.
Yeah. Yeah. So, it's interesting. I think, when I hear you describe the company and what you have to offer, it screams wellness. It screams employee wellness programs, right? It screams prevention. And that is something that, we've had some success in healthcare, but there's always this of, well, who's paying for that and who's going to benefit from that? And then there's also at the same time, it can be somewhat competitive because they've a whole host of substitute like solutions out there in the marketplace. So, help us understand what was some of your considerations as you were looking at your differentiation strategy, entering into that kind of marketplace.
So our differentiation was not just wellness for wellness.
Mm-hmm.
We took a data approach way to being well.
Mm-hmm.
So presently, wellness is I go and I do yoga or I meditate daily. However, what you don't know is that actually what I need right now? Mm-hmm. I don't know that because I haven't stopped to assess that. I'm just doing it because that's the fad to do. And so what we do is we give individuals permission to try and say, that doesn't work for me, but I will try another thing.
Yeah.
So we are presenting different resources in a tailored way that you are able to try it and really assess, is this what wellness is going to be for me? Or am I doing this just because it's cool? Mm-hmm. And it's okay if you want to do it because it's cool, but like understanding your reasoning behind why you're doing the thing is critical to your overall holistic success. And so that's one of our differentiators is our research approach to deciding what wellness experience you are doing. Mm-hmm. And your input being core to that, driving that direction, and us not saying, hey, Roxy, you should do this. Here's your menu, do these things and only these things. And sayonara, I hope you do well. That's not how we work. So how we work is that we give you a menu. And on that menu, you are trying the different things. And you are subsequently building your personal recipe.
So for what works for you. It sounds like it is extremely personalized. It starts with data. So I don't know if you're going to really be able to answer this next question because this is kind of more of like some general things. But for all of the innovators, C-suite executives, busy leaders, out there, as we wrap up here, what are a couple of things that you would recommend to help everyone improve their well-being going forward in this journey?
So in the morning when you get up, before you do your first call, grab your device, do anything like that, just go outside your front door and take 5 breaths. The sun may not
simple, so easy.
Yeah, the sun may not be up yet, But the first air in the morning is so good to our lungs and our body. So that would be something that I would say that's easy for a busy person.
Yeah.
Take 5 minutes and just go outside and allow that to be. And for those that are listening and are like, well, outside is negative something degrees. It's really cold, or outside, by the time I get up, it's really hot. Dressed accordingly.
Mm-hmm.
It doesn't stop you from doing your work. It doesn't stop you from going in your car and going to your office. So think about it as 5 minutes of doing something well for yourself. Mm-hmm. The other thing is daily gratitude. Each of us have someone in our life. Create a buddy system that you are doing gratitudes with that person, where you're sharing what you're grateful for that day. And let me stop you before you're like, that's going to be hard. Some days I'm not grateful for anything. Retool that and say, what went well today?
Right.
Because in spite of all the things that go wrong, we can usually find at least one thing that went well.
Yeah. And even just having that awareness of maybe I need to do some things differently, make some different choices, so some other things go well. But yeah, very true. And the two examples that you provided, they are so
simple,
soft, simple, easy, don't cost money, don't even really cost a whole lot of time, so easy to do. Yeah, thank you for that.
You're welcome.
Yeah. Okay. So Nicola, how can folks get a hold of you if anybody wants to follow up with you, just about your commercialization journey or about the company and what you have to offer?
Oh, sure. If you'd like to get in contact with me, my website is www.join, Kokoro.com. You can also get in contact through the website, through our Contact Us tab. And if you get in contact with us and say, hey, I heard you on Dr. Roxy, we'll do a free assessment for you where you can understand where you are with your emotions and your well-being as you are innovating in healthcare.
Excellent. Thank you so much for sharing your wisdom and your time with us today.
Thank you so much for having me.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.